The whole story? What you did?
Yeah.
Okay.
What?
Good.
I'll guide you.
Oh.
1, 2, 3, go. Well, this is Dr. Lam at topstemcell.com and NaplesPodiatrists.com. Well, a patient here that went through both issues. Number one, arthritis of the foot. We did foot surgery. He's doing well, recovering very well.
Very good.
Unfortunately, he also had knee arthritis too, right here. So we decided to do stem cell on that instead of talking about surgery for the knee, right? So you had a lot of knee pain. So I'll let you describe your knee pain before.
Knee pain is typical of anybody like in a recliner or lying in bed and just starting to move roll your leg, and the two bones, it felt like they're clicking, and you get sharp pain. And the pain level was probably 8, sometimes 9. And we did the stem cell injection with bone marrow from the left leg, and injected it, removed the fluid, and then injected the combination of bone marrow and stem cells in the knee. And I went out of here that night. I've been elevating my leg, so I get a lot of the clicking because the weight is off it and I'm in a recliner. And immediately it went to a 5. The pain level went to a 5, and then elevated to a 6 for 3 days, and then on Sunday went down to a 3. Monday went to a 1, and yesterday was 0. Today is 0. Actually, yesterday was when I got up, it clicked once, only once, so that's why I gave it a 1. But today there's been no issues at all. And this is like in 2 weeks to the day from the injection. It's just unbelievable. When I asked Dr. Lam, I said, how long before you think? He said, well, a couple of weeks, and I smirked. I said, yeah, right, because it was so excruciating prior to the injection. But it's awesome. I would highly recommend it to anybody.
So what the good sir had was actually very bad knee arthritis. It was very swollen. We took out about 20 cc's of fluid from the knee that day on it. And then we injected the amniotic stem cell, 2 cc's of amniotic stem cell, and then we mixed it with the bone marrow stem cells. So he had 2 different kinds of stem cell that we offer here. And because he was bone on bone, history of bone on bone, and history of very bad arthritis, he was very swollen. I mean, his knee was very swollen when we saw him about 2 weeks ago. And so we gave the maximum stem cell available, which is 2 units, which is 2 cc's, 2 million stem cells from the amniotic stem cell. That's how much stem cell we had. In addition to your own stem cell from your tibia, from the bone marrow. So in addition to the 2 million stem cells from the amniotic fluid, amniotic stem cells, we mixed it with his own stem cells, and that's why we're getting the results. At 2 weeks, this is what we have. We're the first ones to do this in Naples, Florida. Other people have been copying it, but the original is always going to be the best. And we've done a lot for our patient, and the results are very typical. Like let's say 2 weeks to you. A lot of people don't believe it because you're in so much pain.
Oh, it's phenomenal. It just I just can't believe the difference. It just went away in 2 weeks' time. It's unbelievable. I'm a big guy. I'm always active. I haven't been, as I say, for the last 6 weeks because I've kept the leg elevated after the surgery 95% of the time. So I'm doing all I can to allow everything to work and heal. And I would highly recommend this for the knee. My other option, and I talked to, I had the cartilage shaved about 12 years ago.
Meniscectomy.
Right, in the knee, and the doctor at that time told me that the next step would be a knee replacement. And a knee replacement versus an injection, and the pain is gone. I mean, it's just incredible. Can't say enough about it. Just unbelievable.
So it went from a 8 out of 10 level pain to a 5, 6, 1 to 0 at about 2 weeks time.
In 2 weeks, in 14 days.
So
incredible.
So perfect. We're gonna keep on going for the good sir. He kept notes. I had him keep notes, daily notes about how you were doing. That's what he was reading from his pain scale. So I wanted to have an insight into how patients were feeling at home. Because a lot of time I do the follow up, and about 2 weeks forward, patients say, "Oh, I do so much better." But I wanted to see day by day, and that's why you volunteered for it. And I really appreciate that.
It's incredible. It went down immediately after the injection. It went to a 5, and then I don't know why, but it elevated for about 3 days. And then went back down, and then just went away. I mean, best thing that's ever happened.
Well, awesome,
Thank you,
sir. I'm
thank
very
you very much.
Yeah, glad for you,
Awesome.
glad for you. Even though you're a Red Sox fan, it's all right. So this is the harvest site right here. That's the site that we harvested the bone graft from. As you can see, it's a small little dot right now. It was a little puncture wound just to get the bone marrow from the tibia right here. So everything looks good right now. It's healed up awesome. Good job, sir. I'll see you back for your follow-up for your foot and your knees looking great, man.
Awesome. Thank you.
No, thank you for helping me volunteer that.
Yes,
Okay.
sir.
I just want to say a quick thank you to our patients and our colleagues that voted for me for Who's Who in healthcare for 2016 and Golf Show Life. Thank you. Look forward to continue treating our patients.